Good afternoon, everyone. I want to echo Rebecca in welcoming you to this webinar. My name is Pete Guess. I am the Economic Policy Director here at Arkansas Advocates for Children and Families, and I'm very excited to share this awesome tool with you today. I just put a quick agenda into the chat that you can see. We'll start off at the beginning here, talking a bit about why a fiscal map. You'll get to hear from the awesome team that put all this together. Uh, we'll talk a little bit about what is strategic public financing. And then we'll get to the most important part, and that is actually a demo of the map. Including some cross-state comparisons, which we find especially exciting. And then we'll talk next steps and wrap things up with a Q&A. So as Rebecca said, keep those questions coming throughout as they come to you, and we'll get those organized and answer them as a panel at the end. Okay, first a little bit about why Arkansas Advocates was so interested in this map. Many of you on the call have worked with us before. I know a lot of our partners are out there. We're excited to have you join us. So you're pretty familiar with Arkansas Advocates for Children and Families. Most people don't know the organization has been around for nearly half a century now. We're coming up on our 50-year anniversary shortly. And you're probably familiar with our mission statement, which I've listed here. The most important thing, we're working to ensure that children and families have resources and opportunities to thrive. We break this down into these 3 bullet points, and the reason I wanted to include these is I hope by the time we get through this webinar, you'll understand that the map really does support all 3 of these efforts. We're in the middle of a state legislative session. We're up there sharing data and important measures of how youth and children are doing in Arkansas all the time. This helps with that. We do believe that really good empirical evidence, a lot of analysis really helps inform good policy. And we're very interested in bringing groups together, and I hope this data helps us in our coalition work as well. Okay, so specifically, why then was Arkansas Advocates so interested in putting this map together? You'll hear a little bit more about the cohort group process and the several years that the Children's Funding Project has been undertaking to put these maps together. We were always jealous we weren't in the first cohort group. We had to do some organizing over here on our end to get ready for it, but we've always been advocating for how important this tool would be for us. Some of you know that we are the Arkansas member of the Annie Casey's Kids Count network. That data book comes out every year and lists children well-being on several different measures. And unfortunately, Arkansas is usually in the bottom 10 on just about any marker. That data is really important. You need data to understand where you are so you can figure out where to go. We know we have lots of work to do, so we need more tools to do that. It's a good time now to actually put a plug in for that data book because we maintain Arkansas version of the data as well. A lot of our partners use that data for all kinds of advocacy work. You can find that data on our website. Of course, it's hard to find any advocates for children and families who would say, we've invested too much money into these programs that serve our families. So we have to argue for increased investment. A map really helps us understand where those gaps are between where we are and where we want to be, in all kinds of areas like healthcare, education, and overall child welfare. Right. And you've probably heard me and others here at Advocates talk about over the past 10 years, we've given away over $2 billion in income tax cuts. That's $2 billion per year that we've given away. So think about how we could use that funding to really accomplish these goals to help all families thrive. We hear a lot of our policymakers talk in terms of budget surplus, budget surplus. We have room to give away, income tax because we have this surplus. We don't think of it that way. We think of underfunded programs or even unfunded programs, right? There's a lot more we could do. We have way too many children living in poverty in Arkansas. We have way too many hungry children. So, how do we use good financial data to point to that? And finally, as a researcher, I'm really, really interested in linking funding to outcomes. We know funding is important. It's not the only factor that affects outcomes, but it is really important. So, how can we make really strong arguments using the map for increased funding that really does increase impact? That's what it's really about. And I will say, you've heard me mention only briefly the Children's Funding Project. Hopefully, you've seen the logo at the bottom and read a little bit about it. There's no way that Arkansas Advocates could have done this project alone. It really is the leadership of Children's Funding Project on this nationwide effort that makes this possible. And although I assisted in the process with maybe some local expertise and local access to budget documents and that sort of thing, it really is the team there that makes this all possible. So, with that, it's my pleasure to introduce Amelia Vaughn. Amelia is the Senior Director of Fiscal Data Infrastructure at Children's Funding Project, and she will introduce herself and the rest of the team.
Great. Thank you so much, Pete, and nice to be with you all this afternoon. Thank you for joining us amidst a busy time and crazy weather. I hope that everyone joining us has been safe and that there's some sunshine your way today. So I lead the fiscal data infrastructure team at Children's Funding Project, but we're greatly supported with our fiscal mapping work by our partners at the Community Innovation and Action Center at University of Missouri St. Louis. And so in a little while, you'll hear from Nat Mudd Brooks, who along with Ari Morris, really they're the muscle behind the fiscal map. They did the research, they did the data visualization, and all the messy middle that you probably don't want to know about in between. So, but they're super grateful to have them on the team, and they've done a great job with this report. And also would like to mention Kylie Bednar, the co-director of the center as well, and our partners in this fiscal mapping partnership. And for those of you who don't really know us at Children's Funding Project, we work nationwide with states, communities, and now Native nations to expand equitable opportunities for children and youth. So very similar to Arkansas Advocates' mission, but we like to do this by focusing on strategic public financing. And think of strategic public financing as adding a roadmap for how to fund any strategic plan. So you have a strategic plan, how are you going to pay for it to actualize it? And we answer these three questions when we do strategic public financing work. The first of which is, bedrocked within fiscal mapping. So how much funding supports our goals right now? Then you can go on to determine what will it cost to meet our goals in full, and then what are ways to achieve that cost, or to fundraise, or to generate revenue to meet that cost. But really today, focus on fiscal mapping, and that's the piece of data infrastructure that we're trying to embed in each state across the country. Many of you may know this through your own experience in trying to review a budget document. Even though they're publicly available, they are extremely hard to read and to understand. And there's no way to really, unless you are that budget professional, by looking at a budget document, there's no way to understand how much is going to children and youth in full, let alone by trying to analyze that maybe by specific categories, like to a specific age range or service type, because there's so many different funding streams that are in support of multiple programs, age ranges, et cetera. And so that's what we're trying to do with these fiscal maps. We take that very, very technical budget detail and put it into a data tool that is digestible. It's child and youth focused, meaning that we're looking at not a breakdown of the agencies and department funding, but really like what's that aggregate going towards in order to improve the well-being of kids and their families. And we truly believe that the fiscal maps foster dialogue and support that data-driven decision-making on current spending, like Pete was saying, like that empirical evidence that can drive policy change. And as you'll see in a minute, the fiscal map answers these questions for us. And oops, sorry, one step ahead. So in 2022, we at Children's Funding Project started to create this national database of synchronized fiscal maps. So beforehand, we were doing bespoke maps for each entity that we worked with, but there was a big need to do some comparisons across the country. That was always the first question we got after presenting a fiscal map was, well, how do we compare to our neighboring state or community, et cetera? And so we wanted to synchronize the way that the data is collected and visualized and also talked about across the country. And so as you see here, like Pete said, Arkansas missed out on the first wave of the cohort, and now we're in wave 3. And we have almost half of the country mapped. And by the end of this year, all of these states will have up to date and up to our current methodology of mapping the fiscal data. So meaning that all of these states data will be able to be compared. And then our goal is that by the end of 2028, we will have a comprehensive sweep of the country in all 50 states mapped, and then up to date over time and used. So kind of 3 prongs to our approach. But I feel like I've done a lot of talking, and now it's time to see the data. So I'd love to introduce to you all Nat Mudd-Brooks, and she is going to walk through the Power BI.
Thanks, Amelia. I'm going to share my screen now. All right, thanks for providing that overview. Always great context to, just learn about what exactly a fiscal map is. And so this is going to be our landing page for the fiscal map. And the text in the middle is just going to be a blurb about some of the parameters that we have conducted this analysis under. So we're looking at 0 to 24. So if you hear us refer to cradle to career, that encompasses 0 to 24. We've also included fiscal years 2019 to 2023, so pre-COVID, post-COVID. And then over here on the left side, we have kind of our table of contents, and you can navigate to any of the pages by clicking on these little buttons over here. So I'll start us off by diving into the summary page. And so this is going to be our overview for the fiscal map. And what kind of sets this aside from the subsequent pages that we're going to look at is that it provides an overview over time, whereas we can dive in on specific fiscal years for some of the other pages that we're going to look at. So what's on this page? We've included a trend in funding over time. And so that's representative of all the different levels of funding that we've included in this analysis. So that's going to be federal COVID relief / federal relief funding, state general funds, as well as state special revenue. Below that, we have outcome category as well as level of intervention. Some of that Amelia mentioned when she was setting the tone. And again, you can check these out by fiscal year. And so for outcome category, we're looking at educated, employable, healthy, safe, supported, and connected. And if you're interested in kind of learning more about what our definitions for these are, what you can do is hover over the different slices or the different portions of the bar chart, and you'll see that appropriation amount and additionally that definition as well. And then level of intervention, we have basic services. That refers to anything from healthcare, nutrition support, things like that. Intervention and prevention, as well as positive development. And the same thing goes for this chart as well. You can hover over the different portions and a definition for each of those will come up, because I know positive development comes up in a lot of different spheres, lots of different organizations, and people have understanding of what that means. But for purposes of the fiscal map, that's going to be focusing more so on education and workforce development. A few other features on this page, we have a little search bar down here. And so if there's something specific that you're interested in diving in, what you can do is type in childcare, and our list will change, as well as pull up or change our visuals to reflect all of the funding streams that mention childcare in the funding stream description. Lastly, on this page, I want to mention this annual percent change as well. And those are represented by the fiscal year 2022 appropriation and the fiscal year 23 appropriation. And so if it's red, that notes that there was a decrease in funding from just those 2 fiscal years. And whereas if it's green, an increase in funding from those 2 fiscal years. Oh, one other interaction piece to this page is if you are interested in diving more into like these specific levels of intervention or specific outcome category, what you could do is click on the legend. And again, you'll see that our charts change to reflect those funding streams that represent outcome category educated. So now on this page, there's a few different things that I want to highlight here. I'm really excited about this page because it's going to give us an overview on trends in funding, as well as a look into some of these different parameters that we've been working on collecting. So starting at the top, we just have a count of funding streams. So as you adjust these different filters, you'll see that number change. And for just a little demo, I will use nutrition support as an example. Again, you can use this just like a filter, like a search and filter, or you can scroll through our list of eligible services and find something that's maybe more applicable to you in your line of work and select that. And again, you'll see that that populates 25 funding streams in this list here. And if you're interested in getting a closer look at what's in this table, you can opt into focus mode and it'll blow up the table and you can look at it more intentionally that way.
Excuse me, Nat, could you also just zoom in just a touch and show everyone how you can do that, please?
Yes, for sure.
Thank you.
Yeah. Okay, so the focus mode button is going to be this button right here that it kind of hides a little bit if you're not touching the table directly. So if you just hover over it, it should pop up, and that's called focus mode. Some of the other filters we have on here are similar to what was available on the previous page. And so if you're interested in just looking at state funds, you could then again filter for those state funds. Again, you can look at outcome category, level of intervention, it'll populate the list. So from here, there's an additional drill through to help us do a deep dive into specific funding streams. And so using school food services as an example, what you could do is click on that funding stream and you'll see that the button above turned orange, asking us to, or prompting us to click on it to go to the next page. And so then it creates a bit of a funding profile for each of those funding streams. And you could click on any of the funding streams and get to this, to navigate to this page. But essentially we have at the top here, the name of the funding stream description, and then these different descriptive parameters that we've been working to collect. And so it'll tell you the funding level. Some of the other things that it mentions is outcome category, in-state administrator, some of those eligible services and programs, if there's a matching requirement or it's part of a matching requirement. So with this funding stream in particular, this will align with the National School Lunch Program, which does have a mandatory matching amount. And so that's what that would note there. And then, lastly, on this page, we just have the trends over time for those specific funding streams that you click on and navigate to this page with. And then you can always go back with this button here and follow that same process to look at any of the funding streams. And you can clear out your filters with this button up here. So next up, we have an age analysis. And so like I said, we are analyzing ages 0 to 24. And we have also opted to include prenatal services as well. And so anytime you see a -1, that is noting prenatal. And again, you can navigate by fiscal year. So if there's a fiscal year you want to dive into, you can do that there. And then age range, this works as a slider, or you can type in the age range that you want to populate as well. Works both ways. And then below here, we have 2 different analysis pulled out. So again, the count of funding streams. So that's going to be the number of funding streams that are supporting the age range that you select. And then the total funding here. This isn't going to be represented like specifically nailed down to an age range, but it's going to be inclusive of all the funding streams that touch a specific age range. And so that number will probably look higher than what the exact number of dollars flowing towards a specific age range might look like. And you'll see I maneuvered it enough that it did change the funding streams that are in the table. And then below that, we have just a little breakdown of the 0 to 24 population, kind of break down into 5-year increments here, just to start to understand like number of funding streams flowing towards a given age range based on population. And that's it for the age page. So our final page of analysis is going to be a state budget comparison page. So the previous pages that we looked at were inclusive of all funding levels. So federal, state, COVID relief, but this page in particular is only looking at our state funding. And so there's a few different ways that you could look at this page in particular. So you'll see in our drop down, there's a revenue type drop down there, and you can choose to look at it with general and special revenue combined, just with general revenue, or just with special revenue. But as we walk through it, I'll just opt in for the combined, and then again, the fiscal year. One thing I do want to note real quick is that the final page of the report is a methodology page. And there you can find more information on what is specifically included in special revenue, because it is not just funds that are labeled as special revenue in the budget. It's more inclusive of education excellence, tobacco settlement fund, things like that. And so you can find more information on that in the methodology page, which I'll touch on here in a minute. But moving through this page, we have another population breakdown, this time including 25 plus, whereas you can see what portion of the population in Arkansas is 0 to 24. And then below that, we have a revenue breakdown that looks at what portion of the budget is going towards children and youth. And we've kind of called out some specific line items of spending that tend to be on the larger side. And so that would be like K-12, higher education, the green portion, and then Medicaid, this small little sliver of red, small relative, of course. And then this blue part representing all the other portions of the budget that aren't supporting any services related to children and youth. And then this chart here, the appropriation by department, again, similar concept to our breakdown of yearly revenue spending, but it's looking more specifically at those different departments. And so the orange portion representing what is going towards children and youth, the blue portion representing what's not. And so like for education, for example, we would most likely think that 100% of that is going towards children and youth, but we have been kind of selective on what's included and excluded. And again, you can read more on that in the methodology. But for the purpose of education, what's excluded here are things like workers' comp and retirement funds as well, was the other big chunk. So that is that analysis. And then the last thing on this page is a per capita amount. So this is going to be based on the 0 to 24 population. And additionally, the appropriation amount for both general revenue, special revenue, and then combined. And so if we click through the different revenue types, you'll see that those change, as well as for the fiscal year. And because the public school fund takes up such a large portion of general revenue specifically, but also just spending towards children and youth in general, we did create an analysis that did not include that portion of funding, just so we can start to understand, like outside of K-12, what services are we supporting with our dollars. And I'll just click through the general revenue and special revenue just to get an idea of what those breakdowns look like. And you'll see this analysis in particular shows that about half of the budget is K-12 out of all of the general revenue spending, which is a little interesting. And not something that we see in all of the states, but it really is just dependent upon how a given state allocates money towards their public school system. And because Arkansas generally supports their K-12 system with general funds, that would explain why it makes up such a large portion. And then lastly, I'll hit on the special revenue here. And you'll see that this looks much different compared to our combined amounts as well as our general revenue amounts, in that the children and youth portion is only making up about 11, 12, 15%, if that. And so that is our state budget comparison page. Oh, and then one other note, I'm sure most of you know this, but in fiscal year 2019, there was some restructuring of agencies. So I would just expect like a small margin of error there, since that restructuring of agencies wasn't established until fiscal year 20. So lastly, we're here at the methodology page. I won't spend too much time on this, but I'll just provide some high level just to give some greater insight into how we've conducted our analysis. And so kind of starting with that data collection process, some of the sources that we've tapped into are publicly available both at the state level and at the federal level. We do have a process of inclusions and exclusions, like I was saying with the education piece. This is the first wave of states that we are including things like Medicaid, facilities and transportation. That was something earlier that we haven't included, but we have opted to include this round. There's some more definitions of those descriptive parameters. And then lastly, the other thing I wanted to touch on was the use of estimates or proxies. And so this is really applicable with block grants and higher education funding that doesn't necessarily all flow towards children and youth under 24. And so we wanted to use the proxies to get a better estimate and a better idea of the amount of money flowing towards children and youth. So you can read up on that in the methodology page. And I'm going to go ahead and stop sharing since that is the last page, and we can come back for questions at the end.
Thanks, Nat. I want to spend a little time talking about how we here at Arkansas Advocates plan on using the fiscal map. I hope through the course of that demonstration, lots of light bulbs have gone off for you, and you're like, yes, this is a way we can use it too. That's the goal, to have all the advocates out there finding this as a useful tool, a great source of data as you uh, try to advance your own policies. So I won't go into a lot of detail because you're about to see some great examples from Amelia, but here's just some broad categories. So if we think, for example, of fiscal policy, I'm fond of saying the state budget really does reveal our priorities. What are our goals? What are our ambitions? What is our vision for the state? So just take one example. We don't have universal pre-K in the state. So what wraparound services are proven to really help young students succeed in public school? Okay, how much of it are we funding those, and how much could we be funding those? So where's that gap? What do we need to advocate for to really get us to a level that makes sense? Related to that is impact analysis. I mentioned before the Kids Count data center that has lots of good data telling us the well-being of children in the state. Well, we know, for example, that Arkansas is first in hunger, right? And so what are we now investing in programs to help with that? We know universal breakfast at schools is going to be in place soon. So what else needs to happen there to really see that number of children who are hungry go down? All this comes back to advocacy, right? I can't tell you how many times we've been asked by lawmakers, but what aren't we funding? And to what level should we be funding it? And so having a tool that really helps answer that question is really important as we spend time in the Capitol. But it's not just at the state level either, because there's good federal data here, really helps with federal advocacy as well. We've all heard a lot about potential reductions, federal reductions to SNAP and Medicaid funding. So really looking at the nuances of how those federal dollars come in, how they're matched at the state level, and how the loss of that would affect overall funding across the state. Even so, adopting that down to the county or the legislative district level, so we can have some really good fact sheets for legislators about how children and families will be affected. You've heard a brief definition of strategic public financing. If we as a community come together and say, this is where we really want to be in the future, using this data to say, okay, this is where we are, and then thinking about, okay, what is the roadmap to getting that additional funding in place? And just one concrete example that the Children's Funding Project helps with is so-called children's funds, right? So can we find a dedicated source, revenue source for a children's fund that will address some of these issues? Well, I think if we're going to advocate for that, we really need to know, okay, what do we need in that fund? What dollar amount do we need? How do we get there? One thing I'm especially excited about is cross-state comparisons. Again, lawmakers are often saying, what are the surrounding states doing, right? Or who's doing this well, or who's not doing this so well? So being able to compare these different funding streams and what other states are doing could be quite helpful. I should add, and I should have added this to the list, it's not just cross-state comparisons, but it's longitudinal comparisons. So what are those changes over time? Nat demonstrated some of this, how you can graph these funds and seeing how they're changing over time, or maybe just staying level, right? If we're just staying level, we're likely moving backwards, especially over the past couple of years with inflation being really high, right? So that's important data to have. And finally, I'll say something about partnerships and coalitions. Many of you on this call, on this webinar, participate in some of the same coalitions we do. I'll just mention one of them. That's the Strong Families Coalition. It's a diverse group of members that come together. And those members are interested in issues across the spectrum, like housing, disability rights, healthcare, women's issues, community development, these sorts of things. But one thing we agree on when we come together is advocating for being united in this call for a strong fiscal policy that really does meet the needs of Arkansans. And so having a tool that helps those coalitions expand their knowledge, their data, their information as they advocate together is really important as well. And again, I hope you're finding you're thinking through some of your own ideas about using this tool. At that point, I'll turn it back to Amelia.
Great. Thank you so much, Pete. And so I mentioned that as a nationwide effort, this fiscal map partnership, it's really like we have lots of goals in mind, but almost like 3 prongs to our approach. So making a fiscal map for each state in the country, updating that data over time, and supporting the use and application of that data. So we're super excited that Pete and his team and others in the state are ready and interested in applying the data, and we want to be there to help too. So please just reach out to us if you have any questions or if we can be of support, and we're going to continue working with Pete as well after the map is complete. And what's also been exciting and I think helpful is that as we've added more states, we've had a few years under our belt of this data being out there, we're starting to amass really great examples of the impact and applications of the fiscal map data. And I keep, a detailed tracker and add to it almost every day. Those examples kind of land in one of these 6 buckets. And then we also have some more as well that aren't shown here that we're tracking too. But I do want to save some time for question and answers. I have a few slides, but if you're interested in learning about some maybe similar places that have used their data, or learning about how to use the data to fit any of these buckets, please let us know. I'd say kind of like the elephant in the room is preparing for budget changes and forecasting those changes. So like that's one way we want to be of support, and glad, at least the data can be there to help people right now. And Pete also did mention some state-by-state comparisons, some national comparisons. And I have a few slides just giving you a flavor of that. So also within our plan for the fiscal map partnership, as I mentioned that, after this Arkansas map is done, we're going back to that first wave of states and updating their data to be up to current fiscal year, and also with a new methodology elements that Nat mentioned, like adding in Medicaid data to all states, as well as like facilities and transportation, so that all of the 22 states that we have maps for will be really apples to apples comparisons. Another thing that we've been able to do more recently is look at how those states utilize large federal funding streams and block grants differently. And so at the end of the year, once all those updates are done, we will be releasing a national trends analysis that really dives deep into those comparisons. But this is just more of like a sneak peek or preview about what's to come, and pulling out the states that surround Arkansas that we have data for. So this first page is how all of these states have utilized their TANF funds differently. Based on expenditure data from the federal government. You can see there's a lot of variation in, basic assistance. So it's that cash assistance payments to families, childcare, transferring up to 30% of TANF funds to CCDBG, or Child Care Development Block Grant funds. And you see some more like technical pieces like program management, transfer to social services block grant, et cetera, and variation, being wide across those different expenditure categories. Similar analysis, but for community services block grant. So you can see how these funds are supporting housing and housing insecurity, education and cognitive development, services supporting multiple domains. This is in support of low-income families and may include childcare, like adult care, as well as acquiring documentation like birth certificates, workforce support, just kind of like a general economic mobility support for families. And then lastly of this, federal comparison across states, we looked at Title V expenditures. And these are the age ranges where like the states have used those dollars to support these different age ranges as noted by the Administration for Children and Families. So child and adolescent health, this is for ages 1 through 21, perinatal 1 and below, and women maternal health, obviously prenatal health included, and then children with special health care needs. Just interesting to note that there is no documented expenditures for Arkansas supporting that 0 to 1 year old age range here, with the majority of it going to the child and adolescent health. And then I just decided to riff on that a little bit more. And these next few slides will show like just a very like kind of quick example of the type of data that you can pull from the fiscal maps in order to get at these state comparisons a little bit more. So diving in a little bit deeper to explore and to create dialogue around maternal and child health spending across these states. The way Nat did with the filters on the funding stream profile page, I just searched for state funding, for the level of funding with maternal and child health as the eligible service and program, and looked across these states to see what states are investing additional state funds. This is not including Medicaid, we do have Medicaid included in the fiscal map, but right now we don't have the level of specificity to say Arkansas uses X percent of their Medicaid towards support, like covering births, et cetera. So I did provide that just statistical information here. But these, you see looking towards like Kansas, they do have a pretty significant state level investment in maternal and child health programs, including maternal and child health line item, Black infant mortality, and newborn screening programs. And again, I went to their fiscal map and did a similar search, even though their interface looks a little different because it was using our old methods and visualization. You can still search for the same data. And then also Tennessee was the only other states that I looked at that included state funding for MCH, mainly supporting pregnant women with substance use and abuse issues, newborn screening, and PRAMS, which is a pregnancy risk monitoring study. And because Pete had told us previously that Arkansas is the most food insecure state in the country, I just thought it would be an interesting eligible service drill through and state comparison that we can look at. So Nat showed you how to do this live for nutrition support. This isn't the total amount of funding. Obviously, I wanted to ground it in a per capita estimate just because, the amount of funding Arkansas compared to Texas wouldn't be too helpful, but the per capita is a little bit more helpful. And so these are state general funds per capita that supports ages 0 to 24 with nutrition support, federal per capita, and then that total per capita. The state general funds include like the food nutrition service that Nat drilled through for you all, which is a state match for National School Lunch Program. Sometimes there are additional state funds here, like Texas, they have a state match for their WIC program, which was counted. Other federal funding includes any funding program that happens within the school system, WIC, SNAP, etc. And so I hope, that this is helpful just as a example of how you can start to apply this data now and to foster some of these conversations. And for our last slide before questions, I'll pass it over to Nat to talk about the next steps for the report.
Thanks, Amelia. So our work here isn't done after we close this webinar out, because this is a living document and we want to continue to update it over time. And so our plan is to continue to add fiscal years biennially. And so we'll do another update here in a few years to include the most up-to-date fiscal year data, but also just as we continue to learn, making improvements to our methodology and our data visualizations over time. And to that point, if you ever notice anything on our fiscal map that looks off or might be your area of expertise and something that we just didn't get right, we appreciate that feedback and encourage you to contact us, and we would love to correct that and connect. So then looking like across this partnership that we've created, we are going to continue to add all 50 states. Emilio touched on that briefly, and our goal is to have that done by the end of 2028. And also just to continue to grow this partnership across different states so that different partners have access to and can use the data. And then additionally, as we are gathering this information and data on all of the states, updating the national trends analysis. Amelia touched on that just a bit. And so we would love to be able to compare our states, but we can't do that unless all of the data is like comparing apples to apples. And so including Medicaid, transportation, facilities, those things that we weren't inclusive of in the first round. And so lots of more and exciting things to look forward to, and lots of hard work to get there as well.
Great, thank you. And these are our contacts, our emails. If you do have any questions or comments on the fiscal map, please reach out to us, and we're happy to talk about the data, the use of the data, etc.
And I'll give people a minute to put their questions in the chat or the Q&A. I don't see any at the moment, but I do want to let everybody know that if you go on Arkansas Advocates website, aradvocates.org, in the middle right-hand side of the screen is a button that goes to the fiscal map. So you have the fiscal map link in the chat. I'm going to send it in a follow-up email as well. But if you ever need it outside of that, it's on the main page of our website. Any questions? I don't see any. Is there anything that y'all didn't mention that you want to wrap up with?
I'll just say I'd love to hear from partners across the state and how they're using it. I'd love to partner with you on using it. If we can work together on, getting some of this data out there, doing some of the advocacy work, that's great. Just don't hesitate to reach out to me here at Advocates, and you can always come to me. And if it's a technical issue, I'm happy to reach out then to the CFP or the whole team. Yeah. So just yeah, I'd love to hear from you.
Well, thank you everyone for joining us and thank you for the great presentation. Again, we'll send the recording and the slides out afterwards, as well as a link to the map itself, of course. We appreciate you so much and hope that you find this tool really helpful. Thank you, everyone.
Thanks, everybody.